Today's topic is gynecologists answering your ovulation questions. Now, are you monitoring your ovulation or have questions on ovulation because either you are trying for pregnancy or you're trying to avoid pregnancy? Then this is the video for you. So let's talk about what is ovulation. As a woman, we are born with millions of follicles, we call it, which has got eggs in it in our ovary. As we grow from birth to our puberty, the number of eggs continue to decrease. And by puberty, we have 75,000 or something like that, thousands of eggs left in our ovaries. So every month what happens is that bunch of follicles or bunch of eggs start growing. One of it becomes a dominant follicle. That's the boss. It grows to the point where it's about 20 millimeter or so, where there's a fluid collection happens around that egg, and then that dynamically, it's a very cool process of that egg just gets released. When the follicle breaks, the egg gets released, the chemical around that fluid, around that egg, attracts the fallopian tube. And this fallopian tube will take the egg and take it to the uterus, and that's where the fertilization happens when the sperm comes in through the vagina. So that's the ovulation process. Now, when does it happen? It's different for different people, but it typically happens about 2 weeks prior to your next period. So if you have a typical 28-day menstrual cycle, it will happen on day 14. But that doesn't mean it happens in everybody on day 14. So don't get stuck on that number, okay? It is usually 2 weeks before your next cycle. And the other thing is, you do not ovulate every month. It's very normal not to ovulate every month. So if you're monitoring your ovulation because you want to get pregnant, don't be discouraged if you don't see ovulation for a month or two. You have to monitor it at least for 3 to 4 months before you seek help from your gynecologist. So the next question, how do we monitor ovulation, right? Well, there are lots of apps on the phones right now, but remember, these apps are good only for people who have regular menstrual cycle. So they could have a 28-day cycle, will be a day 14 or so. If it is a 30-day cycle, it will be day 16 or so. So the app will help you out kind of figuring it out what's your fertility window. And the fertility window is the window where you have likelihood of getting pregnant. Because once the egg is released, it's only good for 24 to 36 hours and that's it. So use the app only if you have really good, normal, regular menstrual cycle. Second way of checking it, it's called a cervical mucus test. Some women are really good at checking that. It's kind of hard, but you can kind of do it also. So what it is that right before ovulation, there's an increasing amount of mucus from your cervix. It's very stretchy, it's clear, it has no odor, and you will see that increasing. So when there's the highest amount of that cervical mucus, the ovulation happens afterward. So though it's a little tedious process, you can do it. Third thing is called basal body temperature charts. Now what it is that every time, every day, really, literally every day, before you get out of the bed, you have to take your temperature and write it down on a chart. There's a special thermometer you can use called a basal body temperature thermometer. So you will have, your doctor will give you a chart to plot this temperature. And what happens at the ovulation time, there's a slight increase in the basal body temperature. It could be even a half a degree or so, but there is an increase, and then it stays high in the luteal phase, like that's the phase after ovulation, and it decreases. So it will help you pinpoint, but retrospectively, right? Because by the time you figure out when you ovulated, the ovulation has already happened. But that is a very easy, simple, cheap way of monitoring ovulation. And the fourth way of doing it is to use over-the-counter ovulation kits. Now these are the kits where they come with a bunch of test strips and you pee on the stick to see if there's a change in the color. So what these kits are doing is they are measuring or monitoring the amount of a hormone called LH or luteinizing hormone. Now the LH hormone peaks just before ovulation. So these ovulation kits can predict when you are going to ovulate. So different ways of monitoring your ovulation, but monitor it, write it all down, and take that log to your gynecologist so you can figure it out. Do you need help? Are you ovulating? Are you ovulating at the right time? Do you need any medications? Or it will also help you figure out when to have sex to get pregnant or when to avoid sex so you don't get pregnant.